Part 8, Aging by the Decades. This is one of my favorite parts. Exfoliation is really important during this time. Both manual and chemical exfoliation should be added to address dullness and to encourage the skin cells to rejuvenate and do cellular turnover. These changes may sound a bit disturbing, and sometimes the client is alarmed about them, but there are actually a lot of things that your client can do in their 20s so that they can delay looking and feeling older as far as skincare goes. In your 20s, to combat the first signs of aging skin, the first thing that we recommend as a skincare coach would be to make sure the clients immediately upgrade their anti-aging skincare routine. If they don't have one, it's way past time to start. There are two ingredients in anti-aging treatments that are particularly important, and one of them is serums and the other one is moisturizers, both daytime and nighttime. And don't forget to look at the cleansers and toners they're using in their 20s. This typically has to change in this particular decade from when they used in their teenage years. It also might be a good time to start using collagen stimulating and retinol based skincare products, which help boost collagen production, retain elasticity, and combat other signs of aging. Antioxidants should be incorporated too. It's important to note that in their 20s, clients can only use retinol about twice, maybe 3 times a week in its high strengths that we recommend. And in the 20s, it's time to introduce some dermatological approved procedures. For example, you might want to suggest that they try one or more laser therapies, anti-aging laser therapies. If they've had issues with acne scarring, microdermabrasion might reduce scarring and even out pigmentation. And it also stimulates collagen production, which could be fabulous. These boosts for their skin and their appearance will take them right into their 30s. Fundamentally, the 30s are a transitional time, according to many skincare experts and dermatologists. Skincare coaches and doctors and all say that clients will actually see the early signs of aging, and this is the time when the first significant and noticeable effects of sun damage from the 20s and teenage years will appear. The 30s mark the decade where all of your clients post-puberty hormonal swings that affect the skin have finally subsided in about 99% of the clients. And notably in skincare coaching, 30-somethings typically are more stable in more aspects, all of the aspects of their life, and these stressful times are reduced across the board. They've looked in the mirror a few times and definitely are seeing some changes, so they're often more than ready and willing to invest in their anti-aging future for skincare. Adding antioxidants in the 30s, if they haven't already done so in their 20s, is something a skincare coach can't emphasize enough. Antioxidants will help repair some of the sun damage that started to develop over the years. Antioxidants will help your clients brighten dull skin, smooth out uneven pigmentation, ward off free radicals, and help stimulate and rejuvenate collagen production. In this decade, collagen and elastin production declines, and so too does the production of hyaluronic acid. Hyaluronic acid is the lubricant that is important for muscles and tissues, and in its absence, it has a detrimental effect on the skin's appearance. The lack of hyaluronic acid will make the face look slimmer and more angular, making it appear more mature and older looking. In the 30s, the client's skincare rejuvenation, revitalization, and repair system actually slows down quite significantly, which means that skin can appear older and duller as a result. To ward off these changes of a decrease in collagen production means that their skin will appear less tight. So you have to talk to them about this. They might tell you that they're worried about their wrinkles turning into deep crevices. They might mention that their skin seems less elastic and thinner overall. This might be especially apparent in the bags under their eyes or the blood vessels and broken capillaries that have appeared on their cheeks and nose. At this age, men especially might see their blood vessels also begin to become more obvious, especially around the sides of their nose and under their eyes. In their 30s, clients really start seeing fine lines begin to deepen, and they'll notice that their cheekbones and brows are not as high as they once were. The volume in the cheeks and the beginnings of facial sagging has the clients questioning how to slow down the anti-aging process in their skin. And those with olive complexions, especially in their 30s, are seeing under eye changes appear more predominantly, and heavier tags appear under the eyes, as do dark circles that might have been caused by excess melanin production from sun damage. In addition to an anti-aging routine of cleansing, moisturizing, serum, sun protection that they started in their 20s, a skincare coach should now absolutely recommend that they add retinol and peptide-based serums at least once a day for the peptide-based and 2 to 3 times a week for the retinol. These once a day to help with the fine lines and wrinkles that are starting to form. This is a great recommendation. Peptide-based serums at least once a day will help with fine lines and firmness as well. Late in this decade, your clients will start to see more prominent lines and wrinkles, so they might be asking about injectables that are administered to help reduce their appearance. In the mid to late 30s, accumulated damage from sun exposure begins to be more unmistakable, with hyperpigmentation being a major skin issue. When this is apparent, skincare specialists often recommend treatments like laser therapy, like IPL or photofacials. These can help with discoloration, removing excess melanin, and evening out skin tone. Experts typically recommend any treatments that encourage cellular turnover, such as chemical peels, microneedling, making small punctures in the surface of the skin to stimulate growth of new collagen, for example, or radiofrequency or heat therapies to help induce new collagen and elastin production in the deeper layers of the skin. All of these are great. There are different products and treatments you can try to address the issues that begin to accelerate in the client's 30s. In particular, applying sunscreen is imperative. Incorporating an antioxidant cocktail into your skincare routine and trying to look for products with multiple antioxidant ingredients with higher concentration is important. They should ask their skincare professionals and their medical professionals and their coach about specialized targeted treatments that help boost cellular turnover and collagen production. IPL, photofacials, laser treatments, microneedling, or nanoneedling are also pretty good as suggestions. This is a time when clients will also step up retinol usage. In the 20s, skincare coaches recommend twice weekly use. Now it's best to use retinol 3 to 4 times a week. If you make the recommendation to treat the client's skin with several serums, one for anti-aging, perhaps with CoQ10 or DMAE, which is also known as a facelift in a bottle, colloquially, and other anti-aging ingredients, and then other serums for their antioxidant properties, perhaps, and consider a protective or soothing serum too. Switching to a more hydrating nighttime moisturizer in this decade is especially one with a little bit more oil to help hydrate and repair the skin's damage and stress overnight is really important.